Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Ledgelight Health District. The goal of this program is to bring you information on a wide variety of health topics and to introduce you to the great people doing important work across the community. Today, I am joined by Dr. Lynn Sosa from the Connecticut Department of Public Health, and today we're going to be talking about monkeypox. Dr. Sosa, welcome to the show.
Thanks for having me.
Great. So I would like to start off by having our audience have a chance to get to know you a little bit. Tell us about yourself and how you got into public health.
Sure. So I am originally from Chicago, Illinois, and I came out to the East Coast to go to medical school. And I trained in internal medicine. But when I was in medical school, I had always had an interest in infectious diseases. And so I thought that's where I was headed. But I started learning about opportunities in public health, and I learned about a special fellowship program with the Centers for Disease Control and Prevention called the Epidemiologist Service. And as I learned more about that program, which is basically specialized epidemiology training for medical professionals like physicians and scientists and folks like that. I really was excited about that. And I think part of it was because I liked the idea of being able to impact more than one person at a time. And so when I finished my internal medicine residency, I did the Epidemic Intelligence Service with CDC for 2 years. During that time, I was actually based in Connecticut. I was based here at the Department of Public Health. And when I finished my fellowship in 2007, I was able to stay on as a permanent employee. So here I am. And now I am the acting director of infectious diseases and the acting state epidemiologist with the Department of Public Health.
Excellent. Well, we're so lucky to have you, all of your expertise. So we today are going to talk about monkeypox, but I'd like to hear in your position, what are some of your other areas of focus?
Right. So as I just said, I am actually the acting director of infectious diseases. And so I do oversee all of our activities related to all infectious diseases. So a lot of our work is really focused on public health surveillance. So what that means is collecting information on a wide variety of diseases. Physicians and laboratories are required to report to us. There's a list of reportable diseases that they have to report to us, as well as when they identify an outbreak or anything like that. And then depending on the disease, some of the work that we might do is just collecting data and information about it. For other diseases, we might actually be interviewing the person to try to understand, where we think they got the disease from, or try to learn more about the risk factors for the disease. And then there's other diseases where we're actually really involved and try to make sure that people have the right treatment. So for example, for tuberculosis, or to do contact tracing for things like some of the sexually transmitted diseases. So we're also the folks that make sure that kids get their vaccines, and providers are knowledgeable about that. And then when we have new or emerging diseases like monkeypox, then we're the ones that are making sure that we're responding to that and that healthcare providers know about it, that there's testing available, and things like that.
Such important work, and obviously a busy department, very important work. And we're so glad that you're here with us to talk about monkeypox. Now, I'm a health educator. I do a lot of prevention work. That's what keeps me busy when I'm not filming Healthwatch. I want to talk about monkeypox. A lot of people don't really even know what it is. Is it a new virus?
So it's really not a new virus. It was actually first discovered in the 1950s. And the reason it's called monkeypox is because it was first discovered in monkeys. But really since then, so to be clear, you cannot get monkeypox from monkeys. It's actually been a disease that's been around for a while in certain parts of Africa, primarily in some rodents and small mammals. People might remember about 20 years ago, we had a very large outbreak in the United States related to imported prairie dogs. So it's actually been around for a long time. In kind of a limited fashion. What's different this time is how it's spread and how many countries are affected. So as I mentioned before, monkeypox used to be something that was really limited to a few countries in Africa, but starting this past spring, countries in Europe started seeing cases of monkeypox, and monkeypox is not really a disease that we see in any other parts of the world. And on top of just seeing monkeypox infections, they were seeing it in people who identify as gay, bisexual, or other men who have sex with men. And it was related to large raves and parties. And so that was definitely new. Unfortunately, we saw those infections spread. So at this point, there are, I think, almost 200 countries that have been impacted by this current outbreak of monkeypox.
Wow, very interesting to hear about that and the development and the history there. When we look at Connecticut, what would you say the current situation in Connecticut is with monkeypox?
Sure. So to date, we've had 138 cases of monkeypox identified in Connecticut residents. And similar to what we've seen in the rest of the country and the rest of the world, our cases are primarily among men and primarily among men who identify as having sex with men or otherwise LGBTQ. So unfortunately, that is the population that we are seeing the infections affect. Cases have been going down. So we saw our highest number of cases at the end of August. And since then, they have been decreasing, but they are still out there. We're seeing 2 to 5 cases a week for the last couple of months.
All right. So what does it look or feel like when somebody has monkeypox? What are the symptoms?
Sure. So again, because we knew about monkeypox, but on a limited basis, so many more people have had monkeypox than we've ever had the experience before. So we're really, over the last couple of months, really learning about monkeypox and how it spreads, and also how it is spreading now, which is primarily through close sexual or intimate contact. We're really kind of seeing different locations on the body that the rash can be and things like that. So we really are seeing the full spectrum of disease. So kind of a classic monkeypox case first is that the person might feel like they have the flu. So they might have a fever, they might have a cough, they might have a sore throat. And then usually within a few days of that, they will start seeing a rash. And the rash might start off as a few pimples, and the rash can occur anywhere on the body. Again, in this situation, because of how people are being exposed, we have seen many infections in genital areas, but the rash really can be anywhere in the body. And then over time, that rash evolves. So it might start off as a few pimples and then goes through stages. It can look like vesicles, and it can then eventually look like pustules. Some people can have just a few of these, of this rash, like a limited rash, or it can be all over the body. So it really depends on the person. It depends on what other medical conditions they have. And in general, the rash can last for about a month.
Really important to know. I know when news of this first started to come out, I think there was a lot of confusion and people were like, oh, how do I know if I have it? And I have a rash, does that mean, so it's important to talk about all the details here.
Right.
So you touched on this a little bit. How is it spread, and is it highly contagious?
Sure. So again, I think really in the beginning, because we hadn't had as much experience in the United States with monkeypox, we're really trying to understand how infectious it is. And, it is really primarily spread among people who've had really close contact with somebody who has a rash. And so that is really the situations that we're seeing. There is a concern for, again, because people are infectious from the time they have symptoms of any kind. So that's a good thing about monkeypox. People are not infectious until they're actually sick, but that it can include that kind of flu-like illness. But again, what we're seeing and what we're hearing about from the national picture of monkeypox is that people are getting it because they've had close contact. I'm talking like really close skin to skin contact with somebody that actually has a rash. So that's really what it takes. This is certainly much less infectious than, for example, COVID or flu or any respiratory illness like that.
Good, really important to know. So I told you that, I'm all about prevention in my day-to-day work, so I think it's important to talk about. Um, what are some of the key prevention tips for monkeypox that apply to this?
Sure. So I think the first thing is that are people understanding, if they might be at risk. So again, if people are engaging in certain sexual activities and being really in tune with like the other person, if they have a rash or a rash they're not sure, or a rash that they haven't had a doctor see, then it's really, really important that people recognize that and they try not to engage in sexual activity there, make sure that they're getting that evaluated. That's really the first thing. And I'm sure we'll be talking more about testing and things like that. One good thing about monkeypox is that we do have a vaccine available. And the vaccine is really effective when somebody has had close contact with somebody really early on before they actually get that rash. But then also we are providing that vaccine to people who are at increased risk for being exposed to monkeypox and trying to prevent persons from getting sick with that vaccine.
Great information. All right, we are going to take a quick break, but we'll be back right here with more with Dr. Sosa on monkeypox.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays.
Ready!
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
It's a new day because COVID vaccines just got a big update, just in time for everyone who works with other people, just in time for more togetherness, just in time to say, oh, you bet we'll be there. Because the updated vaccines can now protect against both the original COVID virus and Omicron. And that's a moment we've all been waiting for.
Welcome back to Healthwatch. Today we are talking about monkeypox. Before the break, Dr. Sosa and I were talking all about the history and development of monkeypox and some of the symptoms, things to look out for, general information that people probably want to know. As we jump into our second half, we have a lot more questions that I'm sure people have questions about. So let's jump right in. Dr. Sosa, we started talking a little bit about vaccination. Who is eligible to get vaccinated?
Sure. So in Connecticut, we want to make sure that we're giving the vaccine to people who are at the highest risk for being exposed to monkeypox. And as I mentioned before, unfortunately right now, that is primarily among the LGBTQ population. But our criteria are pretty broad at this point. So for example, if somebody knows that they've had a sexual partner in the last 2 weeks was diagnosed with monkeypox, that's our highest priority. Those are persons that are close contacts. We want to make sure that they get vaccinated as quickly as possible. If in the last 3 months, somebody has known that they were maybe exposed to somebody with monkeypox, they didn't get sick, but maybe they're engaging in high risk behaviors or activities, then those are people that are eligible. And then we actually have kind of a whole set of criteria on our website that are available. But basically, we're really trying to make sure that people that are at increased risk for being exposed are the ones that are able to be vaccinated. And we've been doing a lot to make sure that vaccine is available in different clinics in the state. So since the summer, we established a network of over 20 clinics where anybody who identifies themselves as meeting one of those criteria that we have laid out, they can make an appointment and make sure they get the vaccine. And in addition, we're working really hard to have mobile vaccination clinics out to different parts of the state, understanding that some people might not feel comfortable going to a doctor. And we're trying to make sure that people, anybody who is at risk is eligible for getting the vaccine and has access to the vaccine.
That's so important. It's great to hear about more of the mobile clinics and that access to care that we talk about, making it easier for people, removing some of those barriers. So that's really important. We see that with some other things too. So that's great. This is a frequently asked question. In preparation for our talk today, I asked if, hey, does the health department get any questions about monkeypox, like any frequently asked questions that I should bring up today? And one of them was, if I have had a smallpox vaccine, do I need to get a monkeypox vaccine?
Yeah, and so that recommendation has changed a little bit over the last couple of months, but at this point, yes. People who received smallpox vaccine back in when if they're of a certain age, they might have gotten it as part of their childhood vaccinations. Or maybe as part of their job in the early 2000s, some people were vaccinated. But at this point, it is recommended that if somebody is at risk for monkeypox, that they actually get vaccinated and actually get both doses. So the vaccine that we're providing, it's the Jynneos vaccine, it's 2 doses, 28 days apart. So if somebody is at risk for monkeypox, then they should definitely get both doses of that vaccine.
Good to know. Thanks for clearing that up. Now, we're doing a lot of talk about vaccines right now. You may have mentioned a couple of them. Are there any guidelines for the vaccine that people should know about?
In terms of what type of guidelines? Sorry.
Like who should be getting it? I think you mentioned, and then
yeah.
Like say for instance, somebody just got a flu vaccine or a COVID vaccine. Anything people need to know before they get vaccinated? Sure.
So the vaccine is a live vaccine. However, it has the virus that's in there is inactivated, so you cannot get monkeypox from the vaccine. So there's some considerations for some of the other vaccines. However, you theoretically can get COVID and monkeypox vaccines at the same time. Again, that's something to kind of discuss with whoever is giving the vaccine about some additional considerations that might be out there. But in general, it's actually really well tolerated. It can be given to anybody, including if they have HIV or other immune compromising conditions. And so that's really a good thing about this particular vaccine that we're using right now.
Great, important to know. So what should somebody do if they think they have monkeypox? Right.
So if they think they have monkeypox, they definitely need to call their healthcare provider. So at this point in Connecticut, we've really spent a lot of time making sure that healthcare providers know how to test, that they have testing supplies available, and something we learned from COVID is the importance of making sure that testing is more widely available. So our state public health laboratory does offer testing. Any healthcare provider can send testing to our state laboratory. However, there are several commercial laboratories that are also testing. So testing really shouldn't be a barrier. We do recommend that if someone thinks they have monkeypox, to call their healthcare provider first. To make sure that they're ready and that they have all the right equipment that they would need to be able to see the patient quickly and get them tested. And then if someone really thinks they have monkeypox, they really need to be staying at home and isolating themselves from anybody else in the household until those test results come back.
Good, important to know. And in terms of treatment, say somebody is diagnosed with monkeypox, what do the treatments look like? What's available?
Sure. So a lot of the treatments available for monkeypox are really symptomatic type treatments, and it really depends on what part of the body the rash might be located. The rash can be very uncomfortable, especially if it's in genital areas or in the anal area, and sometimes can be painful, unfortunately. And so there really are symptomatic treatments that are available for people that have much more severe disease. So Unfortunately, we've seen situations of rectal bleeding. The rash, especially for very extensive rashes, again, can be painful. Certain people who have HIV or other immune compromising conditions can have more severe courses of the illness, although we fortunately have not had many people hospitalized and very, very few people die from monkeypox in the United States. But there is a medication called tecovirimat, or TPOXX for short, that providers can give to persons, especially if they have really extensive disease or have HIV or an underlying medical condition that might put them at increased risk. And so we have instructions on our website for how providers can get the medication to their patients as quickly as possible. The drug is an investigational drug, which means that the person needs to give their informed consent. But we've done a lot to make sure that anybody who needs to get TPOXX can get it in Connecticut.
Great, that's so important to know. I really thank you for joining us today, Dr. Sosa. We've covered so much. I believe our take-home messages today are, know your risks, know the symptoms. If you think you have monkeypox, talk to your doctor. There are vaccines available if you need one. Anything else? What am I missing?
And that there's treatment available, right?
Treatment
if
available.
somebody wants it. Yeah. Right. And so I think all of this information is on our website, and we've tried to make it really easy. It's www.ct.gov/DPH/monkeypox. So healthcare providers can go there, patients can go there if they're looking for where they can find vaccine. If you want to see our latest data, there's a link on there too. We update it every week, so you can see how many cases we have, as well as how many vaccines we've given out so far.
Great, and that's so important to know where you can get the trusted information, and it sounds like the website's a great place to start. So thank you so much for joining us. It's great speaking with you and finally getting to meet you and learning more about this topic. I want to say thank you to everybody who's out there watching today. We hope you learned a lot. I certainly did. And we hope that you'll join us next time right here on Healthwatch.